Good afternoon. I'd like to welcome you to this daily COVID-19 update. This is coming to you live from PACTV studios. I'm Steve Triffletti, Plymouth Town Moderator, and today we're going to be joined virtually by a number of town officials. Kenneth Tavares is Chair of the Board of Selectmen, Melissa Arrighi, Town Manager, Gary Maestas, Superintendent. We also have Michelle Bratti, who is the Director of Elder Affairs. We have Amy Naples, the Executive Director for the Plymouth Area Chamber of Commerce, Keane, the Director of Public Health, and Matt Muratore, our Plymouth State Representative. I'd like to begin by having Ken Tavares begin today's show with an update. This is coming to you live on March 20th. Ken, welcome.
Thank you, Steve, and thank you to PACTV for providing this valuable service. The Board of Selectmen has been extensively engaged with the town manager in a number of questions that have come up in the last few days, especially since we closed down Town Hall. I can tell you that every question is being answered. Some of them require a little research, but the board and the department heads under the leadership of the town manager are taking the right steps at the right time. I do want to just divert for a minute and talk on a very serious tone to the parents of children in our community. We have noticed that there's been an increase in children at our recreation facilities, at the playgrounds, and this is dangerous. Young people don't fully appreciate, what is ahead of us, and we need to sit them down and make sure they do understand. They're playing a game of basketball, being very close on the equipment at the skateboard park is dangerous. So please, parents, talk to them, help us make sure that children don't put themselves in harm's way. It would be much appreciated. Steve, that's my intro for today.
Thanks, Ken. So for those of you watching, you can send your questions to PlymouthInfo@pac-tv.org. That's PlymouthInfo@pac-tv.org. This is being cablecast on Comcast Xfinity Channel 15, Verizon Fios Channel 47. You can also live stream on pac-tv.org, and for replay information, check the schedule at pac-tv.org. We'll continue with each member of the panel, and then we'll go to the question and answers. And I was going to go to Melissa Arrighi next, who is our town manager. And Melissa has joined us again by Zoom, as all the participants are. Welcome, Melissa. Can't hear you. Are you unmuted?
Yeah, you should.
Now we can hear you. There we go. Thank you.
Okay.
How are you today?
I'm very good. Yeah,
Good.
It's busy. There's a lot of questions coming in. We're getting as much information out as possible. I just did an email to all the town employees because I know they're anxious as well. This is such a change for everybody, and closing the buildings, very stressful for them.
Thank you. So, Melissa, we're going to come back to you with some questions, but at this time, we're going to go to our next participant, which is Dr. Gary Maestas, and we're going to welcome Dr. Gary Maestas, who is the Superintendent of Schools, and he has Zoomed in today to join us. And welcome, Gary.
Thank you for having me, Steve, and thank you for once again hosting this on PACTV as well. You know, this is uncharted territories for the school department. We have had a number of adjustments that we've had to make on the fly. It evolves every day. You know, we have a number of things happening across the community to support our families, even though we're not in school. But our concern is trying to keep those services up and running and try to get our students a level of education and continue that learning process. So it's been challenging. I was on a call earlier this morning with the Commissioner of Education, and indications are is that we're gonna continue to plan more as our days go forward and try to create more and more opportunities for learning if this does continue, which indications are now that we may extend that. So we'll have to see how things go in the days to come.
Thank you, Dr. Gary Maestas. We're going to move now to Karen Keane. Karen is the Director of Public Health in the town of Plymouth. Welcome, Karen.
Thanks, Steve. Hello, everybody.
So, Karen, since you were with us last
So,
weekend, what
as you
can you provide us with any update that you might have?
Well, currently, as you can imagine, things are still fast and furious as the Board of Health is concerned. We are taking phone calls and emails still, so if people have any questions, they can certainly still email us. People have a lot of concerns about locations being closed, other locations that are still open, and should they be closed. We have people coming, lots of questions about what they should do now that they're home, what can they still reach out to people. So I think there's a lot of concern from our residents, but I think the most important thing that we all can still agree on is that our information has been consistent and it is out there and it's easily accessible. And I think that, so far so good.
Thank you, Karen. We'll come back. Next, we're going to go to Michelle Bratti. Michelle is the Director of Elder Affairs in the town of Plymouth. She works at the Center for Active Living, and we'd like to welcome Michelle today. And Michelle, what can you tell us?
Thank you, Steve, so much for having me, first and foremost. Just as Gary said, on the other side, people in this community are so concerned about seniors, and senior safety is our number one priority. We're focused on the Meals on Wheels program, ensuring that is distributed and our seniors have the meals that they need. That's kind of the operation that we're focused on. But any senior in need or any senior that is in any kind of at-risk situation, we're encouraging community and family members to reach out. We want to make sure that we take care of people. We've had an amazing outpouring from the community to support seniors and volunteer. So we're really happy about that.
Thank you so much, Michelle. And now we're going to move to Amy Naples. She's Executive Director for the Plymouth Area Chamber of Commerce. And as we've heard, an outpouring from the community, and I know that includes the business community. Amy.
Hi, Steve. Thanks for having me again. Obviously, things are difficult. Times are tough, and we acknowledge that all industries are suffering. The Chamber's working really hard on honestly shifting this public health crisis to economic recovery at this point. I have a call later today with fellow colleagues of mine at the Massachusetts Chambers, seeing how we can work together and advocate together. I also have a call with the U.S. Chamber today as well. We've launched a number of programs to support our members, certainly during this tough time. We just launched a support page on Facebook. It's called PACC Business Coming Together. It's just going to be an area where you can share, vent, whatever it may be. Businesses can go to that Facebook page. We are launching some virtual cash mobs, encouraging people to get out, purchase gift cards, get takeout, really just support our fellow business members. The Chamber, as we know, is certainly known for networking, collaboration, and connections. So we are working on virtual groups. Next week, we'll be launching those on various topics, just working through our industry clusters and one topic at a time, whether it be HR, relief loans, whatever it may be. We're working on those today, and we'll be launching next week. We are doing one-on-one calls to all of our members. That information and feedback is going to be so helpful in the recovery efforts that we have. And just hearing from us, I think it's reassuring to a lot of our members. So that communication is really key. We're communicating all relief efforts from the state and federal authorities to the business community. Right now, we're working on critical needs with our members, the loan application, unemployment, and advice on HR practices, when to lay off employees, whatnot. We also have a very useful page on our website, COVID-19 Toolkit. There is a number of important links and resources there, as well as working from home, opportunities to do that. It's just really important for people to stay connected, so we can certainly utilize those resources and get that out. Communication is so key right now. Another thing, a common thread we've been finding with our outreach to our members is the mental health part of this. Businesses are under a tremendous amount of stress. We're working with BID on a number of programs, online support options for our small businesses. We also received an update from Eversource, which I thought was important to share with you all, that they are waiving all late payment charges, suspending customer disconnections, and offering payment plans. I think that's important now. We've had a lot of great updates this past week in regards to the loan relief, meals tax, occupancy tax, and sales tax deferment. So those are great efforts moving forward by our delegation. And then supporting businesses. You know, during this time, a lot of us are still being paid. So we encourage you to support our local businesses, because together we'll get through this. We've launched a retailer's guide where people can go online, purchase orders through those online sites. We have a restaurant guide. We encourage people to utilize the takeout and delivery options available that our local restaurants are offering. But certainly we're encouraging people to buy gift cards wherever possible. You know, everybody's feeling this impact, salons, the list goes on, and encouraging people to continue with their services like dog walking and other services that they have. But certainly ways to support your local business community. We'll be pushing those out through our social media graphics. We're your resource for business, and we certainly want to keep everyone connected.
Thanks, Amy. And as Amy said, we do recognize that a number of people in our community are experiencing stress and anxiety. So we're taking on this local initiative to have a daily update every day at noon in order to provide you with verified information from trusted sources and from officials. And now joining us, the local Plymouth officials have been working very closely with the state. And with us today, we have Representative Matthew Muratore, our state representative. Matt, welcome.
Good afternoon, Steve, and good afternoon, everyone. How's everyone doing today?
Good.
Well, let me just give you a little bit of background on what we've been doing on a daily basis. We are actually in constant communication with the leadership of the Massachusetts State House, and we through texting on a by hourly basis and conference calls, sometimes 2 or 3 on a daily basis as well. We're trying to move legislation as quickly as possible. I do have some updates I'd like to go through right now. Some updates that we are getting on a regular basis. As we get updates from the governor, we are passing it along to the appropriate people. As Amy mentioned, with the business community, we've been able to get some good things done through the legislation that we've been passing along to Amy, so she can get it out. So when we get information, we are passing it along. One thing before I go through some of the updates that we have at this point, you know, we are in a situation where this is all about health. It's all about physical health. It's all about emotional health, and it's all about the health of the economy. And I think in a lot of cases, the people that I've been in contact with, people I'm hearing from around the Commonwealth, it's the economy that is really getting people a lot full of anxiety. In whether there are employees that are being laid off, or whether they're small businesses that are thinking of shutting down or have shut down. Like in my case, I have 3 child care daycare centers that I'm in the process of shutting down and laying off 35 people today. So it affects all of us in so many different ways. And I think the connection, and Steve, I commend you for doing this and the town for doing this. The connection we have with one another to help is with telehealth and through FaceTime and Skyping and Zooming. Because we're socially distant doesn't mean we need to be socially isolating. And I know in the nursing home and the assisted living industry, they're using a lot of FaceTime and Skype and Zoom to keep the elders in contact with their families. And that really does go a long way in helping with mental health and behavioral health. Physicians are doing telehealth at this point, and they are getting paid for that. So by all means, call your physician. They will get back to you. They will do it like we're doing it now. They'll probably do a FaceTime or a conference call, phone call with you. But there's a lot of things that they can do over the phone, so you do not have to go into the doctor's office if it doesn't seem to be necessary to do that. With that said, we all know about what's happening nationally. We know that we are still, the governor at this point still has April 6th as a target date. But we also know the reality of what's happening nationally at this point. We know that California is now shutting down. The governor has said in the last couple of days he does not want to do a shutdown. We're not sure, where we're going to go with this. We do have the National Guard that has come in. National Guard is here with 2,000 National Guard folks that are here really to help the healthcare providers or first responders with equipment and distribution of that equipment and supplies. So that's what they're doing at this point. So from the state level, we're not seeing that it will be a shutdown, but it's a day-to-day situation. And nationally, I think we have to keep an eye nationally what's going to happen nationally with regard to that. Some other things for people to know about testing. If you haven't heard, they're starting to get the testing done. They're trying to ramp it up to on the next day or so to at least 3,500 a day, if not more. And there will be places that people can go and drive through to testing if they're not already set up. If they think they need that, there's obviously a criteria questions that need to be asked. This is something that we're getting on a daily basis. I have somebody that's not feeling well, but they can't get a test. There's a certain amount of questions that have to be asked because the tests are limited. Before you'll be able to get a test, so it is on a limited basis at this point. Some other things, and I think Amy touched upon them, the small businesses, the loans are out there. I would encourage people to start applying. Also, if you have mortgages and you're out of a job, you probably, if you haven't already, contact your mortgage company, whether you're commercial or you're residential. A lot of banks and commercial lenders are actually deferring payments on mortgages for 60 or 90 days. There are some that are not, but there are others that are looking to do that. We are looking at serious legislation at this point to see about having that happen here in the Commonwealth for people. So stay tuned for some of that. Another area is the Registry of Motor Vehicles. We've all seen that there are long lines. The reason some of the lines are long is because they're trying to keep 6 feet apart. However, there are people that are going to the registry that don't need to. There have been delays on certain things. So people really need to go to the Registry of Motor Vehicle website to see if my license expired, do I have to do something now? Can I do it online? Or is it going to be delayed for 60 or 90 days and I'll be okay? So there have been a number of measures that really people need to look at to go to the RMV. Also, with regard to our local area, with regard to elections, we are looking at legislation today and hopefully to get it finalized by Monday to delay the election of the special election that was due on March 31st. So some of that legislation is together. I believe that we'll have that passed on Monday if everything goes the way it should. We also will have some other language in there to talk about local elections. At this point, it's a proposal that would allow local authority to postpone their local elections if they so choose. That will, I'll probably have more information on our update, if not Monday, on Tuesday on that. So finally, I just want to reiterate to people, one more thing too, minor thing, but passports. We've been getting a lot of questions about passports. And right now, passports are only being done on an emergency basis for customers that qualify for a life or death emergency situations, and they'll do them within 72 hours. But everything else is pushed off at this point. Also, we are getting a lot of questions about airlines. If you have airline reservations at this point, you really should be calling the airlines. A lot of them have reduced drastically their services and are only really flying people for emergency reasons only. So you might want to check with your airlines to see that. But I know there is discussion nationally about closing the airline industry down as well. And just some reminders on the public health message to all residents. Protect yourself by following what Karen's talking about and has been talking about, and washing your hands and covering your cough, and stay home if you're not feeling good. And we have to protect the others who are at most risk by keeping that distance. And I know I have a number of children as well, and trying to keep them in and keep them at bay, and not want to go with their friends, and buy puzzles and do things virtually online and things like that is difficult to do. But we have to be protecting our older people, excuse me, who are very vulnerable to this. They are, and I'm seeing it firsthand in nursing homes. They're scared. They have chronic issues anyways. So we really need to be able to help our people that are in these facilities, but also elderly people who are at home as well. They're the ones that are going to get this, and they're the ones that are going to suffer from it. So by staying away, it's going to help an awful lot. Don't shake hands or hugs. You can blow kisses to people. Stay connected with friends, as I said, and loved ones by phone or through other technology. And for any more information, the best website to go to is mass.gov/COVID-19. That's going to give you the latest information, and also calling 211 will give you the latest information that's coming from the state. And that's all I have. Sorry for the length of it.
That was Representative Matthew Muratore. Each day, Selectman Chair Ken Tavares and Matt and I will be joined by a number of members of the panel. You've heard all the panel today, and as Matt said, with so many people affected, and particularly our seniors, who many feel isolated, we want to make this daily update available so that people can have some interaction with us. So you can email at plymouthinfo@pac-tv.org. That's plymouthinfo@pac-tv.org. We'll take your questions, and the panel will attempt to answer them. We did a 2-hour presentation last Saturday. We did another one on Monday night, and since then, I have a couple of town meeting updates. First, on Tuesday morning, I issued a declaration to recess and continue both the annual and special town meetings that were scheduled for April 4th. They are now being scheduled for May 2nd, and they may be further continued. We're using statutory authority that allows the moderator to continue for a 30-day period. We'll continue to revisit that. We will comply with the guidelines from the CDC. And following that declaration, the Board of Selectmen met. They determined that Police Chief Michael Botieri would be the person to submit a report to the Attorney General setting forth the reasons for the declaration. And Chief Botieri said, after careful and considerable deliberation, with the spread of the novel coronavirus, the present lack of containment, the risk to most vulnerable populations inherent in public gatherings at this time, for these reasons, we are continuing the town meeting. So again, your questions to plymouthinfo@pac-tv.org. I see Melissa Arrighi on the screen, our town manager. First question goes to her. Melissa, if we do not hold town meeting until mid or late June, does that allow us enough time before July 1 fiscal year commitments to pay our bills? Melissa.
It does provide us with there's some legislation that's available to us, so we'll have a budget in place even if we don't have a town meeting. So we'll also be able to get our tax bills out on time. There is some work that we need to do behind the scenes as far as inputting maps and new lots and deeds, but we think that we can do that work from home, so we don't see any delay at all.
Thank you. Send your questions to plymouthinfo@pac-tv.org. Another question from Melissa. If we don't hold town meeting until after July 1 of this year, from where does the money come to meet our financial obligations?
Well, again, we have special legislation that will allow us to have a budget in place. So normally a town meeting appropriates those funds and sets our budget. In this case, in light of what is going on, we'll be able to do that.
The next question, I'm going to start with Dr. Gary Maestas and then possibly to Melissa. Question was, are there any jobs in the case of the school department where we don't have cross-training experience should the job holders become sick? Dr. Maestas.
Yeah, I think there are some positions that there are specialties that we have. We do have people that can step in some of these roles, but I think it's on a position by position basis with some of the essential functions that we do. Again, in the school department, we have people that are very specialized in what they do. There are 2 and 3 people that work in those offices. So we are at the point where we're, prepared to share those responsibilities. We have prepared those people that have those special tasks that need to get done on a daily basis, weekly basis to work remotely, and they have been set up with the appropriate technology, and they've also been set up with the appropriate permissions network-wise to be able to access these key databases that we use on a daily basis. So we are prepared in the event that we do have some hiccups, and I think it's a matter of sharing and us stepping in to do what we need to do to make sure things are working on a daily basis.
Thank you, Dr. Maestas. Again, questions send to plymouth.info@pactv.org. If we can go back to the town manager, Melissa, the same question. Are there any jobs on the town side where we do not have cross-training experience if those job holders become sick?
Well, thankfully, with police and fire, and EMS, and that's where we need to concentrate. We do have that kind of redundancy. They're all trained and can fill in for each other. We have a healthy staff right now in terms of numbers. We certainly hope they stay healthy in terms of physically, so that because we rely on them to cover this whole community. Now, we don't have redundancy as much in other positions, in administrative positions and tasks. So we're doing a lot of that work right now to set that up. We've looked at an option in our public health department in case the public health director, Karen on this call, were to become ill. I have to say that this is where you see the cooperation between the town and the schools so often. And I know everybody has talked about, or so many people have talked about consolidation, but I reached out immediately to Superintendent Maestas. He put me in touch with a fantastic employee who runs their health services department over in the schools. And she couldn't have been more willing to step up to the plate with her experience in nursing and administration of health services to help backfill that position in the event that Karen couldn't work as our public health director. So we were thrilled to see that, and we're trying to do that same kind of approach with many of our other positions. In addition, there is a strong network amongst the town managers. So we are, as rapidly as I'm working with the department heads, I am working with these other town managers as we share what we're all doing and we borrow from each other. And there may be a time down the road where if we do have somebody in a key position, I'm thinking like a procurement officer, because we have to be able to procure things for the town that we may have to share with another community, and we're going to be equipped to do that.
Thank you, Melissa. And certainly that has been our experience now for the past couple of weeks. We find that elected officials, town officials, certainly a legislative delegation are all in communication, working cooperatively together so that we can respond as quickly as possible to the needs of the greater Plymouth community. And again, your questions to plymouth.info@pactv.org, and the questions are coming in. The question is, any update on inspectional services and certificate of occupancies? I don't know, Melissa or Ken, how you want to take that question?
Melissa?
Melissa? Town manager, any update on the inspectional services and the certificate of occupancies? This has to do with a question for inspections. If we can get Melissa back on the screen here at PACTV. And for those of you that are watching, you can also stream on pactv.org. Melissa, welcome.
Thank you. So we conference call with all the department heads at 9 this morning because we do have some outstanding questions. And I'm putting together a list right now of frequently asked questions that I'll be posting on our website and on our social media Facebook page. One of them is, what do we do about certificate of occupancies? Because we have closings, people in the community have closings coming up. And what do we do about inspections? So I'm working with Paul McAuliffe on that. He's responding to emails right now throughout the day. He actually did a couple inspections today, so he will be available for some of that, as will the wiring inspector, the plumbing inspector, and I'm missing one. So, but it's going to be a case-by-case basis. If we don't see a real urgency or need to bring that staff member out of their home then we won't be able to provide that service. And we are working on what to do about certificates of occupancy right now. Might not be able to do anything on that till Monday because we do have to access some equipment that is at town hall, but we're going to try and set that up remotely.
Thank you. And our panel will change a little bit each day as certain needs come up. Tomorrow, we look forward once again to Brigitte Keane, who is the chair of the Board of Health. She'll be joining us. And in a future presentation, also Stephen Cody, the Director of Economic Development. And I'd like to just share with those of you who are watching that we've also been in close contact with Beth Israel Deaconess here in Plymouth. And they've told us that certainly they're taking their direction from the State Department of Public Health. And they do want us to know the following, however. They're prepared and they're working in conjunction with all 13 Beth Israel Lahey health systems. They have an ongoing and coordinated response to COVID-19. And they have an incident command center that's been in operation for almost 3 weeks, and that is to coordinate services and responses. Effective last Friday, 1 week ago today, there have been visitor restrictions system-wide. So we encourage you to contact the hospital, or you can go online to BID Plymouth in order to determine the visitation policy. Also, non-urgent elective surgeries and testing have been canceled for the foreseeable future, and it's going to be reassessed in 2 weeks. It may be as long as 3 weeks because it's an evolving nature with the COVID-19. Finally, individuals should contact their primary care provider if they're experiencing flu-like symptoms. Their PCP will then determine the next course of action. This is right from the BID communication. This came from Christopher Smalley at BID in Plymouth. I'd like to go to Karen Keane, who is our Public Health Director. Karen, do you have anything else you'd like to add to the people who might be watching regarding public health in the town of Plymouth? Karen.
Yes, absolutely. Thanks, Steve. I want folks out there to know that even though the Department of Public Health isn't actually in the town hall, since the town hall has been closed, we are still actively working and have access to the Maven database, which is the database which lets us know if there's someone in our town that is either been tested positive for coronavirus or is a direct contact with someone who has had coronavirus, so that I can monitor those people while they go through their period of isolation. Also, I want to bring to everyone's attention that we're also working very closely with Beth Israel Deaconess to work on a drive-up facility, which will, right now, we're looking at a location at Walmart where people can come with a doctor's order in their vehicle and with an appointment time that will be scheduled through the Beth Israel Deaconess Hospital staff, where they can drive up in their vehicle and they can be tested for coronavirus without even leaving their car. And the final thing I want folks to know is that the Board of Health, our 5-member board, is continuing to meet on their regular schedule. So their next meeting will be March 25th, 2020. Brigitte Keane, as you mentioned, is the chairperson. I will be Brigitte and I will both be at PACTV studio. The remaining 4 members of the board will be utilizing Zoom so they can also be seen on the screen. And we also have an address I'd like to give folks. If they have any specific questions they would like to ask the board, they can send those to publichealth@townhall.plymouth.ma.us. And the meeting again is March 25th, 2020, and it begins at 9:30 a.m. Thanks, Steve.
Thanks, Karen. And a reminder to our panelists, if you can hardwire rather than Wi-Fi, you might be less garbled. Again, for those of you who are watching, you can send your questions to PlymouthInfo@pac-tv.org. We have a number of questions. Karen mentioned about the Board of Health. Ken Tavares, Chairman of the Board of Selectmen, if I can go to you with this next question, and it dovetails quite nicely with what Karen mentioned. The question is, are regular board and committee meetings going to continue? I know before we came on camera, you had an announcement you want to make about the Board of Selectmen. Ken?
We are encouraging the various boards and commissions to limit their meetings. If it's something that absolutely has a legal deadline and there's no way around it, then you should be calling a meeting. But as I went over the docket that we had proposed for next Tuesday, there was nothing on the docket that couldn't wait. We have to be very mindful of the service that PACTV is presenting. And we don't want to wear out the staff that's here by having them attend many meetings. If the boards meet, it should be meaningful and important and certainly directly related to a legal deadline or something concerning the virus. And we encourage people to follow our lead when we decided this week not to have a meeting.
Thanks, Ken Tavares, Chair of the Board of Selectmen. Let's go to the school side of government with Dr. Gary Maestas. And Gary, possibly you could comment on any school committee or other school-related meetings as we go to Dr. Maestas. Also, a question has been coming in, a question from Plymouth info@pactv.org. And if we can go to Dr. Maestas, this is the question. Is there a free food pickup at the schools? Dr. Maestas.
Yes, we have arranged to have free food drop off every day, Monday through Friday, and this is for students for our schools here in Plymouth. We have locations at Hedge Elementary, Indian Brook Elementary, and Algonquin Heights. We have meals that are delivered there. We served over 400 meals yesterday. And we anticipate that to ramp up over time, but that's 5 days a week. We're also delivering food that is kind of like our backpack program, where we would have food available for kids to take home for the weekend. This is non-perishable items. You know, it could be a box of cereal, some milk, some spaghetti. It could have pasta. It could have cans of tuna, things of that nature. We have those will be distributed every Friday. So today was the first day, and those locations will be in Indian Brook Elementary, South Elementary, Plymouth Community Intermediate School, West Elementary, Hedge, and Algonquin Heights as well. And that will be from 8 to 1 o'clock on Fridays. We would have liked to have the service more often, but the South Shore Community Action Council is running a little bit low on food. So on these days that we go and we deliver food on Fridays and even days during the week, if people want to drop off food, we will get it to the South Shore Community Action Council, and we will have that for distribution. So that is 1 day a week now for the food, the backpack program. We have 5 days a week for breakfast and lunch, and those are at those locations that I mentioned. As far as meetings, the Plymouth School Committee will take up any business that they can. If it's essential, we'll do that online. The direction right now is to use an electronic means like Zoom to be able to run those meetings for crucial information that needs to get on the agenda. So we're moving forward, and we're trying to adapt to this new normal.
Thank you, Dr. Maestas. We're continuing this live March 20th daily update from the town of Plymouth. You can email your questions to plymouthinfo@pactv.org. The next question, I believe, Melissa or Ken, the question is this: is the library offering any services right now? Who'd like to take that? Melissa?
Sure.
Okay.
I'm really proud of the library. Actually, the director reached out to me earlier today, and I didn't even realize that they were doing this, but they are actively posting on their website and on Facebook, and they have children's authors that are reading story times on stories right on Facebook. So if you have children and they're at home and that's something that interests you, we'd encourage all the residents to participate. I'm going to jump on after the show just to see what it's about.
Thank you very much. Again, your questions to PlymouthInfo@pactv.org. And for the panel, you've heard the type of questions that we're receiving. I'd like to now go around to the panel one more time. And Michelle, do you have anything else you'd like to add with respect to programming for our seniors, Michelle?
Just to emphasize that our situation is more about care and concern and safety. And we want to ensure that our seniors are okay. So if you have a neighbor who's a senior, if you know somebody, check on them, keep the, social distance, follow all the precautions. But if there's someone out there that you truly think needs help or needs something, contact me. My email is mbratty@townhall.plymouth.ma.us. I will be checking my voicemail. I will be anything that that we can give out there to help our seniors and get those meals out. We sent 147 meals out today. We have amazing volunteers. Some of our local restaurants were drivers today. Owners of our local restaurants came in and said, "What can I do?" So we have a great community. Let's keep checking on each other. Make sure our seniors are okay.
Thank you, Michelle Bratti, Director of Elder Affairs. You can email your questions, PlymouthInfo@pactv.org. And speaking of our restaurants, Amy Naples, you're hearing the discussion. What else would you like to add on behalf of the Chamber of Commerce? Amy.
Sorry.
Thank you.
Unmute.
Yes.
Certainly, just the fact that we need to be supporting our local businesses, and to all the businesses that are listening, the chamber is here for you. The town is here for you. We are all working together. We're working hard on your behalf, and certainly utilize the resources available. You can visit PlymouthChamber.com for a complete listing. Certainly stay connected for our Facebook page, as well as our email. The staff is working hard. We will get back to you as soon as we can, but certainly support local business.
Thank you. Matt Muratore, our state representative, you're hearing from the local officials. What else would you add?
Well, first of all, thank you to all of you who are on here and your staff and what you're doing. I'll reiterate what Michelle just said. We have an amazing community, and we are coming together like no other community really is. I do want to also reiterate what Dr. Maestas had to say, that the food banks need food. If you could drop off at the schools that Dr. Maestas mentioned, or the Social Community Action Council, let's try the ones that are able to help with that situation. And the last point I want to make is that let's keep in mind, even if we do go to a national shutdown, we don't have to be rushing to the grocery stores and thinking that they're going to be closed. They will still be open. They're still open now, as we're seeing. We're trying to get the word out to people that please don't worry about, you're going to be able to get food. You'll be able to get food. People are running out of meats and eggs and bread and all this stuff because people are gathering so much food. They're not leaving for other, but there are deliveries coming for food on a daily basis to these grocery stores. So please keep that in mind. And finally, I just want to really shout out to PACTV, to Julie and Dan and the entire staff for allowing us as a community to actually be doing this on a daily basis, getting the word out for all the committees and boards that are out there. This is why public access TV is so crucial in our society. So thank you to all of them for what you're doing and what you continue to do.
Yes, of course. Thank you to PACTV. A reminder to the panelists to mute yourself when you're not speaking. Let's come back to Karen Keane one more time, our Director of Public Health. Karen, you've listened to the questions. Anything else you'd like to leave as a parting thought for people who are watching?
Thanks, Steve. A couple of things. Again, I would like to thank PACTV for allowing us to do this, because communication is so key for our residents. A couple of things have come up. Here at the Department of Public Health, we also deal with septic systems, and septic systems and their implementation and their inspections are vital for people who want to buy or sell a home. And I just wanted people to know that those inspections are still taking place. I was out on the road yesterday, and we are definitely still doing those inspections that are necessary to have those septic systems closed up, so no open holes will still be presenting any type of danger to our residents. Also, people can still continue to email me or to send me a voicemail, even though I'm not physically in town hall. I have access to both of those. And also something that is happening here in my neighborhood, and I would encourage other neighborhoods to do the same, is we've established a neighborhood email chain where we reach out to each other, every so often, just to make sure everyone's okay, everyone's doing all right, checking in with our neighbors who are a little bit more elderly to see if they need any assistance. Because I think this town is amazing, and I think our residents are really pulling together and helping each other, and I think that's wonderful, and hopefully it continues. Thanks, Steve.
Thank you, Karen Keane, the Director of Public Health. And before I go back to Dr. Gary Maestas, your questions to PlymouthInfo@pactv.org. I actually received a question, wasn't quite the type of question I expected. It was, what kind of tie am I wearing? And I just tell everybody before I go to Gary, it's a Save the Children tie, and it's for Benjamin, age 16 MVP. So Dr. Maestas, our children in our schools.
Well, I just have a couple of things to say as we close off today. I'm very, very grateful for the Plymouth Education Foundation, the Cobra union that supports some of our employees, and also the Teachers Association here in Plymouth have donated money to actually keep this food program going. So, like everyone has said today, this community has done some wonderful things to try to add a level of normal, which we're trying to do that. And hopefully people understand that this is evolving and will continue to morph over the days. Our offices, if anyone wants to reach our office, they can call the phone system. Everyone is monitoring their phones. My phone rings right to my cell phone, so I have that transferred. Email, if anyone needs to contact anyone, any staff member, email is the best way. They can go right to the Plymouth Public Schools webpage, and on the bottom of that main page, there's a staff directory tab, and you can actually go and you can actually find the person that you would like to talk to, and you can send them an email. And that is the way that we want to try to encourage everyone to communicate specific questions, comments, concerns that we can address on a timely manner. So people are working; they're doing what they need to do to keep things running behind the scenes. But once again, Plymouth is an amazing community, and we're going to get through this together.
Thank you, Dr. Gary Maestas. He's the Superintendent of Schools. We'll continue to do this daily at noon. We're going to circle now back to the town side to Town Manager Melissa Arrighi. Melissa, final thoughts?
So I just want to tell the community that we are indeed still providing services, but I want to take this moment to publicly thank all the patrolmen, all the firefighters, all the employees at Brewster Ambulance, and all the employees that for the town that are actively still working and reaching out and want to help and want to provide services. They take their jobs very seriously. Many of them are upset that they can't come into the office, and we want to be able to support them in any way we can. So I just wanted to make that public. Thank you to all of them, and encourage everybody to check our town website page as well as the Facebook page for the latest information. We're going to get it out as quickly as we can.
Thank you. And now returning to our last panelist, Selectman Chair Ken Tavares, who encouraged me and PACTV to continue to offer this presentation and go to a daily update. Ken Tavares.
Steve, thank you very much. And again, special thanks to PACTV for everything they've been doing for us. The message that I want to leave is really a summation of everything that everyone else has said today. And that is, we want the residents of our town to know that they are not alone. This is difficult at times, and we understand why people might feel that they are alone. They're not. The business community has pulled together. The schools are doing wonderful work, and the government of this community is still functioning. Also, we have great support from the state. It has been much easier to be able to call people, as we were doing yesterday, to work on the elections. People are responding. We need to know the question, and we will find you an answer. We may not have it right away because this is all new to us. And it's frightening at times, and we understand that. But the Board of Selectmen is in full contact with the town manager. There are many, many questions that are going back and forth and being answered. I would like to take the liberty, Mr. Moderator, for you to ask just one more question of Karen, and that is to emphasize why it's important to call 211. We have received calls from people not knowing what to do when they think that they may have signs of the virus, and sending the emails is delaying the time. And if Karen could explain that, I think it would be important to end this meeting on that note today.
It's a great question. Good.
No, excuse me. Thank you. We're Plymouth Strong. We will get through this.
And Karen Keane, final comment in response to Selectman Chair Kenneth Tavares.
Yeah, absolutely. So we are, right now, it's still advisable that if you feel that you are suffering from any of the symptoms for coronavirus, or you have come into direct contact with someone who has been tested positive for coronavirus, you still need to reach out to your personal care physician. The personal care physician will then determine if you need to be tested. You will then be sent to a testing facility where your test will be completed, and then it'll be sent out, and then we will wait for the response. Now, depend upon the lab that it's sent to, the time for the lab for the testing is running anywhere from 48 hours to several days. So that is still one of it's still the criteria to follow if you believe that you need to be tested for coronavirus. And again, 211 is the phone number to reach out with any questions regarding COVID-19 or the coronavirus.
Thank you. That was Karen Keane, Director of Public Health. I'd like to also thank the other members of the panel. Certainly, Selectman Chair Kenneth Tavares will be on each day, joined by Matthew Muratore, our state representative. We also today had Melissa Arrighi, our town manager, Dr. Gary Maestas, the superintendent, Michelle Bratti, the director of Elder Affairs, and Amy Naples from the Plymouth Area Chamber of Commerce. We'll be doing this each day at 12. It'll be on PACTV, channel 15 for Comcast, channel 47 Verizon Fios. You can go to pactv.org for live streaming as well as for replay information. Thank you for joining us today, and we'll be back here tomorrow at 12 noon. Good day.